The global digital health market is valued at over $200 billion. Yet, across Southeast Asia, hundreds of millions of people are still completely disconnected from consistent, affordable medical care. Patients are forced to navigate a labyrinth of isolated systems. They use one app for a doctor's chat, visit a separate physical clinic for prescriptions, and go to completely disconnected facilities for basic lab tests. Because these platforms do not talk to each other, medical records get trapped in incompatible digital silos. This scatters patient histories, leading to expensive duplicate testing and, in worst-case scenarios, dangerous misdiagnoses. This friction is worst for the unbanked. A massive portion of the population lacks access to traditional banking, entirely locking them out of the formal healthcare economy and standard digital insurance plans. The infrastructure built to modernize medicine has actively created new barriers, keeping isolated patients separated from the professionals who can treat them. Watch how a medical payment gets siphoned off. Insurance, payment gateways, and supply chains act as toll booths, inflating costs 20 to 40%. Reversing this for a claim, manual verification loops endlessly, leaving patients financially stranded waiting weeks for reimbursements. These bottlenecks hit specialized care even harder. Prohibitive upfront costs and social stigma prevent individuals from seeking psychological support when they need it most. Putting a broken legacy bureaucracy onto a smartphone screen does not fix the underlying inefficiencies. True accessibility requires rebuilding the core financial and data architecture. That massive architectural rebuild is being spearheaded by CEO Zaldi Urza Palivi. Holding a master's in pharmacy business and operating as a registered pharmacist, his background bridges the realities of frontline medical delivery with complex system design. His comprehensive solution to this crisis is the platform known as Avicena. It operates as a unified healthcare super app built entirely on Web3, a decentralized internet infrastructure where applications run on blockchain networks rather than centralized corporate servers. Avicena is built exclusively on the Solana blockchain, a high-speed network processing over 65,000 transactions per second. Finalizing data in 400 milliseconds for fractions of a cent makes microtransactions for daily prescriptions and lab bookings economically viable. Here, blockchain operates strictly as back-end plumbing. It provides the specific infrastructure required to process real-time, zero-friction medical payments without relying on intermediaries. The platform houses every healthcare touchpoint a patient needs inside a single, unified interface, operating as a standard mobile app and a progressive web application. The ecosystem rests on 8 primary service pillars. Users can chat with licensed pharmacists, conduct video consultations with general practitioners, and order from a health marketplace. That digital layer integrates directly with physical services. Parents have access to dedicated pediatric specialists, while any user can securely book laboratory tests and vaccinations at partner clinics. It also tackles specialized care gaps by offering encrypted chats with psychologists, alongside one-click insurance registration. By routing these 8 pillars through one interoperable network, a patient's medical history and billing profile transitions from a fragmented mess to complete, centralized control. Every interaction across those 8 pillars is powered by a singular digital currency, the Avicena Utility Token, or AVC. Payments are handled through smart contracts. When a patient books a consultation, tokens enter a secure escrow lockbox. Because the code automatically verifies the completed session, it eliminates legacy processors taking a 40% cut. The full value unlocks and flows directly to the provider. Creating a digital wallet to hold this token requires only a smartphone, bypassing the need for a traditional bank account. This allows unbanked populations to immediately participate in the formal healthcare economy. The system replaces vulnerable human bureaucracies with an automated mathematical guarantee. Reviewing the token economics documentation shows how AVC functions as a working utility. Users locking tokens in the staking contract earn passive yields from revenue sharing.
Frequent users accumulate loyalty points, redeemable for medical discounts and reduced insurance premiums. Quality of care is actively incentivized. Doctors, pharmacists, and psychologists earn direct token bonuses for maintaining exceptionally high patient satisfaction scores. Holding the token also grants users governance rights, allowing them to vote on platform upgrades, partnership approvals, and fee structures. The token design establishes a functional economy that actively rewards healthy behaviors and high-quality medical delivery. The long-term roadmap outlines a transition toward a decentralized autonomous organization, or DAO. This is a management structure where decisions are executed by token holders voting on the blockchain, shifting control of the platform directly to its users. This creates a frictionless loop. Patients pay for accessible care, providers earn fair rates instantly, and the underlying network scales without relying on centralized bottlenecks. By deploying this model through a mobile-first interface, Avicena immediately addresses the massive, underserved populations across Southeast Asia. It closes the critical gap between isolated patients and medical professionals, using verifiable transparency, unmatched network speed, and real-world utility. True digital healthcare requires rewriting the underlying economic rules to put medical data and financial value securely back into the hands of the patients.